Yeah.
Dr. J, you want to talk about this new 988 hotline? What's going on?
Yes. So hopefully, maybe a breath of fresh air and hope that we debuted a 988 mental health suicide prevention hotline. It is going to hopefully, I think, eventually replace the suicide phone number to shorten this to like a 411 type um, number for people to remember.
Yeah.
Right now, it has support, unanimous, like both sides of the aisle have given support to it, and at least preliminary funding. And 21 states have also, pledged to have funding for this hotline. So, the question is this hopefully pushing a shift towards like the mental health status, and that making it easier for people to receive the help that they need, and then also in turn could it potentially reduce some of the interaction with law enforcement that goes unsavory when dealing with mental crisis. um,
Hmm.
we've seen plenty of cases where people have inadvertently been shot by the police in response to these. So, can we switch this to professionals trained in
Mm.
this field to help these folks instead and maybe reduce some of those things all around?
All
Oh,
right.
interesting.
What do you think, Johnny?
Um, well, I think they'll accomplish the goal, by having because it's a shorter code. I mean, it's a shorter
It's
number
for a
and
telephone number,
Yeah.
it's easy to remember.
like
It's easy to
911.
remember. It's a short code. Yeah, it starts with a nine. All of those good things. But I mean, I just hope that they get the resources. I whenever it comes to like things like this, I take it very serious, especially with mental health and suicide. And I really, really hope that they get it right because I know that there's been, and even I'll share a story. There's been a time when I've called like a mental health crisis line when I was a teenager, and the call dropped a few times. So there's been times where, and it wasn't like because of my area, it was because of like maybe there was like a lack of personnel or lack of, I don't know. But
Mm.
I just want them to actually get the lifeline right, like, and have people calling, and I know that has to do with funding. I know it has to do with boots on the ground, so to speak. So I just want them to get that right, and I'm all for it. I think it's a great idea and a great step forward.
Mhm.
Yeah, I would agree with you. You know, I, you know, I still want more. Like Dr. J was saying, I mean, this is definitely important and valuable. And I think it will help. 988, if you're having suicide or crisis, but this is more of a personal, this hotline's been there forever. It's just now easier to get to. Um,
Yeah.
but I'm with you, Dr. J, and I'd like to see more with the mental health resources with police departments because it still doesn't deal with the issues when they come up. I mean, because the first people, when you have a mental health crisis and somebody needs help, the first people you call is the police to come deal with it, and they're not ready for that. Um, and I don't know that this 988 solves the problem, because if the person's running around in the streets naked, right? You call 988, all they're going to do is tell you, hey, try to calm them down, blah 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 blah. They're not going to. They're going to do what the hotline has always done. But what I'd like to see is when you call 988 for someone having a mental health breakdown, that they also have access to mental health resources that can come and respond physically as well.
Mhm.
Yeah.
That's what I'd like to see.
Yep.
Instead of the
I thought,
police coming to try to
yeah.
deal with that. And, like I say, I like the step that we're making towards it. I still think it needs to go a step further than it is. So that's my thoughts on it.
Mhm.
Robbie?
I think it's a brilliant idea. Three numbers versus 10. Do I dial 888? Do I dial 866, 800? No, I dial 988. This is wonderful. And
Yeah.
I think that anything that helps people to immediately connect with individuals and resources while they're in crisis is a good thing. I mean, there's only benefits that come about from that. like Johnny said, from a tech perspective, you want to make sure that you have a system that can handle the volume of calls, and you want to make sure that you have the human resources available to handle that level of calls also. Um, like Dr. J and Neo, um, one of the rabbit holes that I kind of went down as I was thinking about this is as we're talking about, the conversation has changed, just defunding the police and, how we want
Yeah.
our police services to respond to things. So I agree that, I mean, if 988 can become an alternative or a separate resource, because like you were saying with your example, Neil, if someone's naked running down the street and there's a 911 call and there's a 988 call. Well, somewhere the system is going to marry that information and go, okay, so yeah, maybe we need a police unit and we need a mental health crisis unit. Or if it's
Yes,
specialized staff,
that's what
or
I'm
if
looking
it's,
for.
specialized individual within the
Police force. Fine.
at the police station, where it's just like, okay, yeah, so send car 52 and then we're going to send our community response team out. Go.
Yeah.
Um, so yeah, I would like to see it handled that way, so that at least at the onset you can de-escalate a situation with a trained professional rather than escalate a situation by drawing weapons.
We're seeing way too many people killed in those exact situations.
Right,
Dr. J,
right.
final
I
thoughts?
mean, definitely. I mean, I'd like to hope that that is eventually the road that it's going to go down, and that, you need to have these alternatives. I think at this point we need to open up and we have to start thinking outside the box, because traditional ways are not working. Traditional ways are keeping people under thumb and not getting help. And if this is going to be the start of it and hopefully it can expand, my concern is definitely that only 21 states have signed on to
Really?
Yeah.
continue to fund this. So,
Yeah.
I fear that the states that don't want to acknowledge that they really need it are going to be the ones funding it, and then those folks in that states are going to be in a lot of trouble.
Wow. So only 21
Wow.
states. That's not
That's
a lot of
in
states.
fact. Yep.
That's not even half.
I know.
Yeah.
That's
I'm
crazy.
surprised at that. I'm surprised at that.
Yeah, that's not even half. All right. So is this truth, lies, or
Truth,
shenanigans?
lies, shenanigans.
Triple true.
Yeah, I'm
This
excited
is
about it. I mean, I'm gonna be
yeah.
honest. I'm excited.
No, this is a great thing. They rocked it for sure.
Yeah, I'm excited.
Yeah.
It's this, much like Robbie's story about the the drug dens that aren't drug
Of course.
dens. They're steps in the right direction. I mean, it doesn't solve the problem, it doesn't fix it, but unlike our foster care system, those are both steps in the right direction. So it's really good to see.
But at least the kids took the initiative to sue them. So I mean, that's technically a step to some type of reform, some type of change.
It's something.
Hit them in the pockets.
That's where you can get them. I hope they get millions, hundreds of millions, because they'll deserve it.
Yeah.
All right. So it's been a tough day of topics, but they were really deep. Appreciate that. So we're gonna have to lighten it up again.